You've tried everything for your child's health, from multiple pediatrician visits to specialists, from dietary changes to supplements, yet your child continues to struggle with chronic issues like sensory processing challenges, behavioral difficulties, sleep problems, or reoccurring ear infections. You're exhausted from hearing they'll grow out of it or being offered another medication as the only solution. And what if I told you that the reason you haven't found lasting answers isn't because there aren't any? It's because you haven't found the right kind of specialized care that actually addresses the root cause. Most parents don't realize that not all chiropractors are trained to care for children, especially those with complex neurological challenges. The difference between standard chiropractic care and truly specialized, neurologically focused pediatric care can mean the difference between temporary relief and life-changing transformation for your child and family. If you're a parent whose child continues to struggle with chronic health challenges despite trying multiple approaches, and you're seeking a practice that truly specializes in pediatric and family care with a track record of helping complex cases, then this video is for you. You'll discover the 5 key differentiators that set apart truly specialized pediatric chiropractic practices from standard family practices, and why these differences matter so much for getting real results with your child's health challenges. Here's a staggering reality that most parents don't know. Over 40% of children today suffer from at least one chronic health condition. Yet the vast majority of healthcare providers, including many chiropractors, lack the specialized training needed to address the complex neurological challenges that are driving these conditions. Most chiropractic practices see a few kids here and there, but they primarily focus on adult musculoskeletal care. This means when you bring your child with sensory processing challenges, ADHD, autism, chronic ear infections, or behavioral difficulties, you're often getting a one-size-fits-all approach that wasn't designed for the unique needs of the developing nervous system. And the result of that? Frustrated families who don't see the lasting changes they're hoping for. So let's jump in and discover what makes the difference when it comes to caring for your child. And it starts with the training. Most chiropractors receive excellent training in adult spinal care, but pediatric and family care require completely different expertise and advanced certification programs. Today's children face what we call the perfect storm. It's an unprecedented level of stress and toxicity that starts early as pregnancy, and it can create complex neurological challenges that require a deeper understanding and knowledge of this reality. Truly qualified pediatric chiropractors have advanced training in developmental milestones, nervous system function, brain development, and the gut-brain connection, and neurological conditions like autism, ADHD, and sensory processing challenges. And this specialized education allows them to understand not just how to adjust children safely, but how to identify and address the root neurological causes of those chronic health challenges. So that's where it starts with the training. But now let's talk about the advanced technology and neurological testing that is used. When we have specialized pediatric practices, they are going to be using cutting edge technology like the Insight neurological scans to actually measure nervous system function and identify areas of stress and dysfunction. These scans are completely non-invasive and take about 15 to 20 minutes to perform, yet they provide more information about the real root cause of your child's condition than traditional approaches would. But it's not just a one and done. It's an ongoing thing. Regular progress scans ensure that real neurological healing and restoration are actually happening, not just a temporary sign of relief. It's an approach that goes deeper than just symptoms. It's objective, neurological data that allows for precise, measurable care plans rather than just putting it to a cookie cutter approach or just guesswork. So now moving on to the office environment. This is super important. The environment that's going to promote healing and the approach designed specifically for families. And this is subtle yet significant. It's a detail that when it comes to caring for kiddos struggling with complex neurological challenges, this matters. Everything from the office layout to the equipment is designed with children and families in mind, creating a calm, welcoming environment for sensory sensitive children. The entire team receives specialized training in pediatric care, ensuring every interaction supports your child's unique needs. This includes accommodations for special needs families, nursing mothers, and busy families with multiple children. And knowing how to care for these families comes from experience. Truly Specialized practices have extensive experience with the toughest cases: children with autism, seizures, special needs, and complex chronic conditions that other providers often can't or sometimes won't help. And because every child has a unique life story, a unique set of challenges, and therefore a unique approach to caring for them, every child receives that, a completely customized, individualized care plan based on their specific neurological assessment. And it doesn't stop there. Care plans are regularly reassessed and adjusted as your child progresses, ensuring that optimal results are achieved at every stage. And this level of expertise means that routine cases like colic or constipation or ear infections, the more quote unquote easier things, they're handled with exceptional skill and success because we're working with much more tough cases. And so now, if this seems like something that you want to learn more about, click the link in our bio to learn more about neurologically focused pediatric specific care and how it can be beneficial and can be the key subtle difference between what helps your family and what helps your child receive the results that you're looking for. Thanks for watching. Y'all have a wonderful and blessed day. Take care. We'll see you in the next one.